I'm Dr. Matthew Weiner from the Pound to Cure Weight Loss Center in Tucson, Arizona. I'm here with Zoe Schroeder, our registered dietitian for the practice. And we're going to talk about what you should eat in the first few weeks after bariatric surgery, how to follow your post-operative diet to get through the process comfortably and easily. So this video was actually one of the very first videos that I ever made 10 years ago. And when I first started my private practice, I was actually based in Detroit at the time. And I didn't have a registered dietitian. I didn't have nurse practitioners. I didn't have all the resources that we've got right now at our new center. And so I had to do all of this. I had to do all the counseling for my patients. It was actually great because it really got me interested in nutrition and I learned a lot about nutrition doing it. But I had to talk and go over this diet over and over and over again. And I said, hey, I got to make a video of this. And I would send a link to the video from all my patients. We put it up on YouTube. And about a month later, my web guy called me. He goes, hey, you should make more videos. You have like 1,000 subscribers on your YouTube channel. I said, we have a YouTube channel? I didn't even know we had done that. But apparently there was something about this video. There's something out there that people really need to hear. And so we decided to update it 10 years later. The original video has almost 1 million views at this point. And so we're hopeful that this is going to be an update and take advantage of some of the resources that we have in our practice now. From that video, actually, I was contacted by a publisher and we ended up putting together the Bariatric Diet Guide and Cookbook right here that really serves as a great resource for anybody who's in the post-operative phase, whether you're right here kind of in the first few weeks after surgery or you're years out. There's going to be some recipes in there and some content that helps guide you through the process.
And so what we're going to do in this video is help you connect the what to the how. You learn the information, right? It's about how do you actually do this post-op. What I hear a lot of times from our patients is, I've taken the classes, I've learned what I need to do, but then as soon as it comes time to do it, a couple days after surgery, it feels much more overwhelming and there are a lot more questions. Some people are like, I just forgot everything you taught me. So we want you to use this as a reference guide to come back and help you understand exactly what to do in each stage and how to implement it.
And I think the patients who get through this the easiest really come back to this over and over again, whether it's a video or one of our support groups online where they're just checking in on a regular basis. Because honestly, in these first months, the first month or two after surgery, every day is different. It's like you're going to wake up, what's it going to be like today? Yesterday it was this. Today it may not be that. It may feel very different. And there's a period of rapid transition. Now this diet is really important to follow because after surgery, you've got brand new anatomy, you've got suture lines and staple lines. And if you overwhelm that with food, food can get stuck or you could even potentially cause a perforation. And so this diet is put in place for your comfort and your safety. And it's really important that you take your time through the diet progression and really be careful with it and don't overdo it and don't push it. You don't win an award when you get to the final stage of the diet. So we break this down into 2 phases. Phase 1 is kind of survival mode. It's get your fluid, your protein, and your vitamins in. Zoe, how much fluid should someone take in the immediate post-operative period? You just got home from surgery yesterday and it's time to drink your fluids. How much should they drink?
So our fluid goal is going to be 64 ounces per day. Now, I do not expect you to be able to actually reach that goal the first day after surgery. What I like to tell patients is take little sips all day long. And as the days go on, you will be able to get more fluid in, but between 40 as kind of that minimum and 64 being that goal. After your fluid, your goal is protein. So protein needs are going to vary based on body size, but generally we want to be between 60 and 80 grams of protein. Now, of course, at first you likely are going to be utilizing these pre-made protein shakes to get your protein in. Ideally, we want to start towards making your own homemade smoothies that contain protein. We have a lot of really great recipes in there. I also recommend utilizing an unflavored protein powder so you can get the fiber from fruits and greens in your smoothies as well. And then our final kind of priority is going to be the vitamins. Your vitamins, where we've got them right here. We want to make sure you're taking a bariatric specific vitamins and make sure that that bariatric multivitamin has iron in it if you've gotten the bypass or if you're a menstruating woman.
So what's the difference between a bariatric vitamin like a Centrum you just get at the drugstore?
So if you look at the back label, the nutrient concentration that you're getting in those bariatric specific vitamins are hundreds, sometimes even thousands of times higher than what you get in an over-the-counter one a day. I also get a ton of questions about hair, skin, and nails, right? A lot of people would like to prevent hair
Who
loss.
doesn't want good hair, skin,
Yeah,
and nails?
right.
Let's be honest,
That's
right?
true. Very true. However, I always recommend don't waste your money on that. If you are taking your bariatric vitamins, you are getting so much more biotin in that than you are in the hair, skin, and nails gummy from Costco.
I think as you move through phase one, when we're looking at hydration, starting with the fluids, starting the protein shakes really right after, as soon as you feel like, hey, I'm getting the fluid in, then we want you to start adding the protein in. And we do count the protein shakes as fluid, right, Zoe? That's always a pretty common question. We have some debate about it. The number one ingredient in a protein shake is water. So I think that it counts. Zoe, and I get where Zoe's coming from because she wants to make sure you get as much fluid as possible because dehydration is the number one cause for readmission after bariatric surgery. But when you're working through this priority of hydration, protein, and vitamins, it's really important to recognize that hydration is the most important thing because if you don't stay hydrated, it's going to be 2-3 days max, and you're going to need to go to the ER. You're going to be in trouble. You're going to have some consequences from that. If you're not meeting your protein requirements, it'll take several weeks, maybe a month or so even, before you have some real problem related to your protein intake. And vitamins, it might be 3 or even 6 months of not taking your vitamins before we start to see consequences of this. So you don't want to take your vitamins, get nauseous from your vitamins, and then not be able to meet your fluid requirements. So hydration is the most important. Make sure you're getting to that 64 ounces as quickly as possible. That's going to keep you comfortable. Then we work on the protein, hitting that 60 to 80 grams, and finally worry about your vitamins. We have our patients take the vitamins for a week or two pre-op, just so that they build up some stores. So if they're not taking the vitamins in those weeks after surgery, that they still have some stores built up and they're going to be okay.
And our nutrition program that we offer here for our patients of the practice, as well as to anybody who needs post-op support, is really great because we have up to 6 Zoom sessions every day. We have evenings, weekends. We try to accommodate a lot of different schedules because we know that support and the ability to come get your questions answered in an environment where there are lots of other people going through the exact same thing you are is super helpful.
Yeah, that's, I think, one of the key is building the community, going through this with other people. That's what's so great about the bariatric community. And so if you're out there, our mission is no bariatric patients left behind. And so our nutrition program, it's fairly inexpensive and we make it available to anyone in the country. We even have people from other countries in the program as well. And we cover anything from this immediate post-operative diet all the way to years and years after surgery. We've got peer-led support groups. So there's a lot out there for you. So if you're at home and kind of wondering, how am I going to get through this? Then, we're out there. We're here for you and would love to help you out in our nutrition program.
You don't have to figure it out all by yourself.
Yeah. So once we get through phase one and are meeting our fluid and protein goals, it's time to reintroduce food. This usually happens somewhere a week or two after surgery. And there's a very structured way that we introduce food because some foods are really easy to eat and others are not so easy to eat. Comfort is really the key. You don't want to rush through this. And another thing that I really try to point out from the very beginning is when we first are starting this post-operative diet, we want to talk about protein first. You got to eat your protein first. That's really, really important in the first few months after surgery. But I don't want you to confuse that as your lifelong diet. What we're doing now is getting you through surgery comfortably and safely. What you're going to do for the rest of your life is maximize your weight loss and eat the most nutritious, healthy foods that allow you to maintain this weight that you lose after surgery. So please don't confuse this as the ideal postoperative diet. This is the ideal postoperative diet for the first few months. So talk to me, Zoe. I finally graduated and I'm ready to take my first bite of real food. So where do I start?
Okay, so step 1 is going to be soft foods. I like to explain it as you don't want to give your still recovering stomach something it's not ready for. So we are going to think about those protein-rich soft foods such as Greek yogurt, cottage cheese is a good option, fat-free refried beans, applesauce. All of that is very easy to digest and won't cause too much upset.
We have a basic rule is that anything in a blender is okay in that first step.
Don't put pizza and burgers in the blender though.
As long as it's not gross. And that's gross, I think, pizza and burgers. And the truth is, I've seen it before for sure, But it's not something that's very common, I think, thankfully. I think most people have enough common sense that, anything in a blender that's not gross. We're talking smoothies, blended soup, that kind of stuff.
Yeah, and a little tip with that blended soup is that you can actually put that unflavored protein powder in there if it doesn't really have a big protein content to begin with.
So a lot of people are diabetic after this surgery. If I'm diabetic and I say I have a low blood sugar attack, which we do see because the diabetes responds so well to the surgery, what should I do? What's the best food to eat in this early phase?
So I would recommend the applesauce or a mashed banana so that you have some of those healthy carbohydrates, but to help that blood sugar go back up, the fiber in those foods is going to help it go up a little bit more gradually and stay there so you don't experience that drop immediately after.
And we allow our patients to take applesauce really from the first day post-operative, even though it's technically not allowed, but low blood sugar can be very dangerous. You can pass out, you can get really sick from it. And so unsweetened applesauce or a mashed banana is a great option there. All right, so I do that. I'm going through it. How do I know when it's time to move on to the next stage?
So great question. First thing to keep in mind is we actually don't assign a specific timeline. And the reason why? Because everybody's different. Just like everybody responds to different foods, some people experience taste change after surgery. It's not up to us to tell you at week 1 you do this, week 2 you do this. So instead, we give you a bare minimum. I want you on each step for a minimum of 4 days. But after that, if you are still reaching your fluid goal, still reaching your protein goal, and tolerating the new foods that you have brought in, it's safe to move on to that next step.
I think every phase after surgery, and there's really kind of 3 phases after surgery. There's what we're talking about now, this post-op immediate period where it's like eat for survival. I'm just trying to get in enough so that I don't end up in the emergency room, I don't develop malnutrition. Then we've got the honeymoon period, and then we've got the end of the honeymoon period. So in each of those steps, there's something really valuable that you can learn. And I think in the post-operative phase, what we're talking about now, it's mindful eating. So how do you learn mindful eating? How can you help patients, Zoe, in the support groups say, hey, I'm getting through this. I need to apply mindful eating techniques. What does that even mean, mindful eating?
So great. And it's something that is a really valuable skill that you can start practicing even before you get surgery. So mindful eating is a way to be very in tune with what your body is telling you and honor that. So that means eating slowly, taking small bites, eating without distraction, so that at that first sign of satisfaction, you can say, oh, I'm going to stop here because I don't want to feel sick.
It's kind of mission critical at this phase, right? Because the difference between comfort and discomfort can be 1 bite. It can be a few extra chews. And so, like Zoe said, really dialing in and figuring out how you can pay attention, eat in an undistracted fashion, and really determine how each bite of food is making you feel. And the truth is, this is a life skill. This isn't something that you should stop doing after a month or 2 when eating becomes more comfortable. This is something that you should implement into your life going forward, and it's going to help you with your long-term success after surgery. So our goal really in this, as we introduce foods too, is to wean people off the protein shakes and get them onto more plant-based, healthier foods. We want this to mimic our long-term diet as much as possible. So after the yogurt, cottage cheese, and applesauce, what's the next phase?
After that, we're going to actually introduce cooked vegetables so that we have that opportunity to start getting some fiber in. At this point, I have a lot of patients that say, I'm craving vegetables. So something like a canned green bean, basically you want that fiber to be cooked down enough that you can fork that piece of vegetable down with the back of a fork. So steamed carrots or really soft cooked broccoli is another great option.
Yeah, I think the way I describe it to patients is you want to think high school cafeteria vegetables, right? That especially, I don't know about how your high school was, Zoe, but we had like 3 or 4 lunches. And as you got older, your lunch got later in the day. And by the time you were like a junior or a senior, you were eating at like 1 o'clock. And those vegetables had been there since like 10:30 in the morning, just sitting in that same water, steaming and cooking. And they were so soft and mushy. That's the kind of cooked vegetable that you want to eat. And again, I think it's really important to distinguish between micronutrients and phytonutrients. So micronutrients are what you're going to see listed on the back of your vitamin, the biotin, the vitamin B12, iron, things along these lines. And they're really important. They're critical. What makes something a micronutrient is essentially that there's a disease process that you'll get if you become deficient. If you're deficient in vitamin D, you develop rickets. If you're deficient in iron, you get anemia. So these are things that we've known about for decades, if not 100 years, many of them. And we take our vitamins, and these are critical things. If you don't get enough, you'll get sick. But then there's this whole other group of nutrients called phytonutrients, and they're only found in plants. And phytonutrients are really vital to your recovery. Nourishing yourself with these valuable compounds, you're going to recover faster, heal faster, have an easier time getting through this. We don't really know that much about phytonutrients. They might be something like resveratrol or flavonoids or some things that you might hear discussed, but they're going to be in these vegetables, and they're really important for you to get them in that postoperative phase, even if it's not something you can directly become deficient at. Okay, so Zoe, I don't know if this is against the rules, but I like my vegetables with a little bit of salt on them. Now, is that okay? What's the role of salt in the postoperative diet?
Great question. So because hydration is so important post-op, actually having some salt on your food is not against the rules.
Good.
Now, long term, I generally do try to avoid salting your foods, buy low sodium canned vegetables, that sort of thing, just because chronically high sodium intake can lead to high blood pressure.
Okay, so I got through the vegetable phase and I'm doing well with that. What's next?
Up next, you're going to be doing eggs. So contrary to maybe initial instinct, scrambled eggs are not going to be your friend. I do not want you to start with scrambled eggs. Instead, starting with poached eggs or over easy eggs definitely will be better tolerated.
Yeah, for sure. What about beans? Can you eat beans in this phase as well?
This is going to be your bean phase also. Any kind of beans you'd like, black beans, kidney beans, all of that good stuff. That is really an opportunity to, again, add fiber as well as great plant-based protein.
Beans, to me, I think are one of the best postoperative foods because they've got carbohydrate in them. And you need carbohydrate to recover from surgery. That's what gives you energy. Fatigue is a very common side effect. So getting some carbohydrate is fantastic. They have lots of fiber. Constipation is very common after bariatric surgery. You're not taking a lot of fluid in, you're not eating very much. So the fiber in the beans can help you go to the bathroom a little bit easier. And then of course they have protein. And also they're really, really easy to eat. When I work with patients and someone says, hey, I'm really having a hard time eating. And most patients get through this pretty smoothly, but there's definitely a subset who have a little bit of a harder time. And sometimes it's tricky. Hey, is this just someone having a hard time? Or do they have a stricture or a narrowing after a gastric bypass? Or their sleeve a little bit swollen? Is there something that's anatomically preventing them from progressing their diet? I often look at beans as kind of my litmus test. If you can tolerate beans comfortably and you're keeping them down, the anatomy's probably okay. To me, they're kind of that perfect bariatric food that if you can eat that, then the anatomy's intact and we just need to give this some more time and eventually things will open up and you'll find it to be much more comfortable.
And the other thing that you will be introducing in this phase, this third step, are soups. So earlier on, we talked about having blended soup, but now that you have introduced beans and veggies, cooked veggies, you can have soup that is not blended up.
Soup is such a perfect postoperative food.
And easy to make in a big batch. You can freeze it. It's great.
All right, so I've got the eggs, I've got the beans, I've got the soup. What comes after? It's getting real now,
Yeah, you get the real food.
We're getting into real food.
So then you're going to be doing fish and nuts.
Yeah.
So fish, you can do something like a canned tuna fish. I actually really like mixing it with Greek yogurt is a little tip there. But also the raw nuts. So, almonds are great. Any kind of nut that you like, honestly, as long as you chew it up really well, nuts are great. You get plant-based protein, healthy fats, fiber.
Yeah, and again, salt's okay now, but long term, you want to do the raw unsalted nuts for sure.
Definitely.
Yeah, which is easier, the fish or the nuts, do you think, for people to eat?
Actually, the nuts.
Yeah.
It's kind of interesting. You might not think so at first, but the nuts, that's going to be a great snack. And actually, one of my patients, she was always talking about how she has her emergency nuts that she always keeps in her purse. So I said, I am going to be using that. You need to trademark emergency nuts.
Yeah, for sure. I think that nuts too are probably number 2 on my list of the perfect postoperative food for really the same reasons. They've got the fiber, they've got the carbohydrate, and they've got the protein. And they're also pretty easy to eat. Most people do really well with nuts. Fish sometimes can be a little trickier though. It really depends a lot on the fish too, huh? Mm-hmm. And that's where your mindful eating comes in, right? So you eat some fish and it goes pretty well. The next day you eat that same fish and it doesn't go so well. Why is that?
Could be the circumstances. right? Maybe you thought that now it's a safe food and you weren't paying attention as much. Perhaps you ate too quickly or ate too much.
Yeah. Also, when you put a food in the refrigerator, it's not the same food the next day.
That's true.
Yeah. And so I think that's really important. That's where the mindful eating strategy comes in. It's like you got to almost play detective. Hey, why did this work yesterday but not today? You look at the food, you kind of look at it more carefully than you normally would. You kind of feel it as you push your fork into it and you say, it's a little harder than it was yesterday. Maybe it dried out a little bit overnight in the refrigerator and it's a more difficult food to eat and I have to eat slower and smaller portions. The biggest mistake you can make is make an assumption about a food before you actually sit down and eat it, because you don't know how it's going to feel today for you. And there's always something you don't know. You don't know what you don't know, you know?
Absolutely. And you're learning a whole new anatomy.
Yeah.
So it's going to take some time while you're introducing different foods, learning how you need to eat to feel your best.
All right, final phase. We're there. So you win when you get to this final phase, right, Zoe?
Oh no, we want to go slow. Take your time. You do not win a prize when you get to this final step. And in fact, if you try to rush through it, chances are you're going to make a mistake and end up having to start from the beginning sometimes. Yeah. So the final step is chicken and raw vegetables. Now, we're not going to be going off of the gate with a baked chicken breast. We don't want it dry. Something like crock pot or slow cooked dark meat chicken is a great place to start because it is much easier to digest. Yeah. Here's where you can also have those raw vegetables. And as we know now, this is something we want for the rest of your life. This is going to be the majority of the volume that we want you to be eating in order to not only lose the weight, but to be able to keep it off. And so raw vegetables is going to be what you can kind of round out this food reintroduction steps with.
I think, you know, like the Inuit people, the Eskimos, they have like 50 different words for snow, because snow is such an important part of their life. And you need to know, is it a snow bank or is it fresh snow? And so I think with bariatric patients, because there's like 50 different versions of chicken, there's that like dry, thin chicken breast that you bake and is really tough. That stuff's not going down for 6 months or longer. But then there's like a chicken thigh that you put in the crock pot that just cooks for hours. And that stuff kind of falls apart on your fork, and that's going to be much easier to eat. So whatever you do, don't think of all chicken is the same, because it's definitely not. And this is again where that mindful eating strategy comes in, paying attention, looking at the food, trying to determine what the texture is, and understanding really how it makes you feel.
Mm-hmm. And having the chicken and the fish, the beans, the Greek yogurt, these are all whole food sources of protein, which allows you to wean off of those pre-made protein shakes. So I like to envision it. At first, likely you're getting all your protein in through protein shakes.
Right.
Then as you start to introduce your food slowly, you're getting more of your protein goals met through those whole food sources. And eventually, maybe around the 3 or 4 month mark, you are relying mostly on whole foods to reach that protein, and the protein shakes more so as a backup.
Yeah, absolutely. Protein shakes are not part of a bariatric patient's diet for the rest of their life. They're part of the diet for the first 3 months or so. And then once you're able to eat food comfortably, that's when it's time to transition over to more whole food plant-based diet. Remember, protein shakes are artificially flavored, artificially sweetened, and a processed animal protein. And that's not what we're looking for over the long run. Over the long run, we're looking for a plant-based, unprocessed diet. All right, Zoe, so we've made it through all the steps. You've worked with lots of patients at this point through this process. If you could pick one thing that makes someone get through this smoothly and easily, what would it be?
Easy. Go slow. This process, you don't win just because you get to eat chicken, fast.
Right.
You have the rest of your life to eat chicken. So going slow, listening to your body, and knowing that this is that recovery process that we want to be very intentional, and then shift towards eating those whole foods as much as you want later on.
I think the key in my mind too, and the way we set up our program, is that for you to figure this out on your own as a patient is really difficult. And it's the patients who come and check in with us regularly through our nutrition program. And again, if you're out there and you need some help getting through this process, you need any help with anything going on in your bariatric life, whether it's weight regain or anything, reach out to us through our nutrition program. Zoe's on there all day long on Zoom. I'm on there a couple times a week as well. If you're in Tucson, we've got live cooking classes and a lot of resources for anybody out there to get through the post-operative eating phase and then really the rest of their life and be successful as possible. That's our mission in life, is to help you get through this and lose as much weight as possible and have the best possible experience with bariatric surgery. If this video was helpful, reach out to us through Instagram, Facebook, TikTok, YouTube, whatever your favorite social media platform is, at A Pound of Cure.